So good morning, everyone. Thank you, Rishad, for including me in this wonderful session. And I'll be talking in favor of ICL in this scenario. So we have started discussing the scenario after this paper, which talks about yellow posterior elevation with the smaller white to white diameter. But the same paper also says that corneal diameter influences corneal curvature and pachymetry. It also influences bad display, and a small diameter is associated with a steep cornea and can give a false impression of corneal ectasia. Excuse me?
The screen is not showing. Can you just... Yeah, it's okay.
And it has also shown that corneal diameter has no role as a single parameter when it comes to risk assessment for corneal refractive surgery or diagnosis of KC. So we have to look the scan in totality, and we have to consider all other parameters. So if we see this scan, which is published in this paper only, with a white to white of 10.8, so if you see DB, which is showing in the red, but we have to look at DT also. So in these cases, DT is always very low. So if DT is low with good pachy and a small white to white, you may consider going for refractive surgery or laser refractive surgery, and if not, go for the ICL. As there is an exception to every rule, we have to look all the parameters in the pentacam, like age. If the patient is very young, 18 years or 19 years, we should not be very overconfident going for refractive surgery. Go for the ICL. Corneal thickness again. So yellow posterior elevation with the borderline corneas like 500, 490, 510, better to go for ICL. Again, the very steep corneas like 47 or 48, go for ICL. And the other D values, what the other D values are saying, except DP. So there are papers which talk about ectasia and refractive surgery with low myopia, like ectasia with SMILE, ectasia with LASIK and all. So if you compare with KLX versus ICL in this scenario, the KLX poses some risk of effect on corneal biomechanics after the surgery, dryness, and quality of vision is also an issue with the refractive surgery in some cases. But with ICL, we can avoid all these complications. So to avoid so many maybes, ICL would be my choice in this scenario. Thank you so much.
Thank you, Dr. Bhupesh.